What common child behaviors are not serious symptoms? Sometimes, children act in ways that seem unusual or concerning, but many of these behaviors are perfectly normal parts of growing up. Knowing what to expect can help parents and caregivers stay calm and avoid unnecessary worry. Let's explore some common behaviors at different ages that are usually not signs of serious health problems. Infants and toddlers often cry a lot, especially when they are hungry, tired, or need a diaper change. This is their way of communicating. They also have tantrums as they learn to control their feelings and express themselves. Exploring by touching, mouthing objects, or testing limits is normal for their curiosity. It's also common for young children to cling to parents or caregivers temporarily, especially in new or unfamiliar settings. This separation anxiety usually passes as they become more comfortable. Preschool children are busy testing boundaries, so saying no or refusing requests is typical. They love using their imagination, talking to imaginary friends, and creating pretend worlds. Nightmares or fears of monsters or the dark happen often at this stage and are part of normal development. Sometimes, children regress during stressful times, such as starting school or a new sibling, and may wet the bed or revert to baby talk. These behaviors are temporary and usually not a cause for concern. School-age children often experience mood swings, irritability, or argue with family members. Wanting to spend more time with friends instead of family is a sign of healthy social growth. Children might lie or exaggerate to avoid trouble or impress others, which is common as they learn social rules. It's also normal for their school performance or motivation to dip during big transitions or stressful periods. These changes tend to resolve over time. Adolescents are exploring their independence, so they may seek more privacy and time alone. Trying out different styles, interests, or mild risk-taking within safe limits is typical. Sometimes, teens question authority or show defiance as they develop their identity. Mood swings and emotional sensitivity are common due to hormonal changes. All these behaviors are part of growing up and do not usually indicate serious issues. Most of these behaviors are not serious if they happen occasionally and are not extreme or persistent. If they do not interfere with daily life, school, or relationships, they are likely part of normal development. For example, a preschooler having a tantrum when tired is normal, but daily, intense tantrums lasting hours might need attention. Similarly, a teen wanting more privacy is expected, but complete withdrawal or suddenly missing school could be a sign to seek help. Parents should watch for patterns, whether the behavior is a one-time event or part of a consistent trend. Think about recent changes or stressors that might explain the behavior. Comparing what your child is doing to what's typical for their age helps put things into perspective. Talking openly with your child can also give insight into their feelings. If you're unsure or worried, it's always best to consult your child's doctor or a mental health professional for guidance. Remember, children will display many behaviors as they grow, and most are not signs of illness or disorder. Understanding what's normal for your child's age and situation helps you respond appropriately. When in doubt, seeking professional advice is the safest way to ensure your child's health and happiness.